quite strict on timing. So everyone has been given just 3 minutes to speak, and you will get a reminder 30 seconds before the end, so that you know when to finish speaking. As I say, it's great that so many people want to contribute, but we do want to hear from as many of you as possible. For those who we couldn't give a spot to because we'd run out of space, please do post anything you would like to say, any comments or questions in the Q&A section. And of course, we will capture all of those as well. So without further ado, I'd like to hand over to Howard Catton, who I'm sure many of you have heard before on many occasions and in the media, who is the Chief Executive of the International Council of Nurses.
Susan, thank you so much. Buenos dias, everybody. Good morning, good afternoon, good evening, bonjour. Walter, ciao. Good to see you. Good to see you. And welcome to this webinar, ICN-hosted webinar with you, the Nursing Now groups. Just to say that ICN has been proud to have partnered with Nursing Now, with WHO on the campaign over the last 3 years. I think it has been a phenomenal campaign. Huge amount of hard work from Barbara and the Nursing Now team, the board of Nursing Now, Nigel and Sheila Tillow, and of course all of you as the Nursing Now groups. You know, history will tell us, but I suspect Nursing Now may well be up there as probably the best nursing global campaign that the world has seen. And whilst the campaign is coming to its natural conclusion, ICN is delighted that many of the groups will be transitioning to us, and we take very seriously, very proudly our work with you to take forward the legacy of Nursing Now. On behalf of the ICN President, Annette Kennedy, and all of the board of ICN, please let me extend their greetings to you all, and also share from Annette her message of support for the work that we have done and that we will continue to do together. We have already, I think many of you will be aware, started to work with many of the Nursing Now groups. At the end of last year, many of you joined webinars that we had with the team being led by the former Prime Minister of New Zealand, Helen Clark, who's looking at the global response to the pandemic. This year, many of you joined the webinars we hosted with WHO as part of the development of the next global nursing strategy for nursing and midwifery, which will go to the World Health Assembly this May. Many of you have also responded to ICN requests for information about what is happening with the pandemic in your country. I'm particularly grateful to those of you who recently told us about where your countries were at in relation to the rollout of vaccines. I hope you will have seen ICN's work on that just last week in terms of the unequal picture that there currently is around the world in relation to access to vaccines. So many of you already involved in ICN work and familiar with what we do. For anybody who doesn't know who ICN is or what our role is, we were established in 1899. We are the oldest of the global health professional organizations, and we are in official relations with WHO to speak on behalf of the nursing profession and nurses, and you will see our work intervening at WHO meetings, supporting WHO policy making processes, but engaging with a wide range of international organizations like the International Labour Organization for Migration, UNICEF, to name but a few. And this really does feel, colleagues, like another critical year for our profession. We are hopefully moving out of the worst stages of the pandemic, though I think we're likeliest to have coronavirus with us and affecting our lives for a number of years to come. But many of the global leaders, and I include ICN in that as well, thinking deeply about the lessons from coronavirus, but what sort of world and health systems we want to come next. So I think very much a year of transition, not just for nursing now, but for nursing and health systems globally. As I said, we'll have the nursing strategy at the World Health Assembly meeting in May, as well as a discussion by the world's leaders about what lessons they have learned from coronavirus and the future course that they want to set. And ICN is focusing on that theme of future health systems for our International Nurses Day this year. Our publication will unpick that issue a little bit more. And of course, we have the ICN Congress, first time ever as a virtual Congress, in November this year as well. So a really significant year, one full of opportunity, but also transition. And I think we'll be making decisions over the next months and year that will be with us and set a course for a number of years to come. And for that reason, colleagues, listening to you today, hearing from you about what the priorities, the key issues are for your Nursing Now groups in your countries is hugely important for ICN to understand that and to have discussions about where we can align and work together and take nursing forward as colleagues from whichever organisations we come from, whether we are from national nursing associations, if we're from education regulation, if we're in government positions, but really to build a consensus and collegiate approach amongst all of us for the future. Final point for me, just to let you know that I said that the board are taking a huge interest in this work. We will be taking your deliberations, your comments, your contributions from today, from the other webinar, from some of the other discussions that we've had with Nursing Now groups, to the ICN board when they meet in May to hear what you have to say, and they will then be thinking and making some more decisions about the future. I hope that's helpful in terms of setting some of the scene. Very much looking forward to hearing from all of you. Back to you, Susan.
Thanks a lot, Howard. And now this webinar obviously would not be complete without us having Barbara Stillwell here with us today, who is the Global Campaign Executive Director for Nursing Now. Over to you, Barbara.
Thanks so much, Susan, and thank you, Howard, and hello, everybody. Greetings wherever you are in the world. Thank you for inviting me to be part of this webinar, and I do bring you greetings from the whole Nursing Now team and Nigel Crisp and Sheila Clow, who, of course, are watching all of this happening with a huge sense of letting go their sort of grown-up children in a way. Not that you are, but what you've been is the campaign has been all about you, all about the groups. And that's why I'm absolutely confident that what you have started will continue with ICN. because the movement will go on, because you will continue to work together to keep the profile and status of nurses high, as Howard says, as we move into this important post-pandemic phase where we're going to be looking wherever we live, whichever our country is, you know, we're all going to be recovering from what this pandemic has brought. ICN has been a wonderful partner for us from the very, very beginning, before even I was involved in the campaign. And I know this because I've recently been reviewing all the early notes about the campaign, because we're doing our end of project report. So I know that Lord Nigel Crisp and the ICN General Secretary at the time went together to Dr. Tedros to ask about getting WHO support for nursing now, which Dr. Tedros really gave with wonderful enthusiasm, and that enthusiasm of WHO has continued. I think the partnership between ICN, WHO, and Nursing Now has really been a force that has kept nursing high on the agenda of policymakers and politicians during what has been an extraordinary time. Partly, of course, it's been our campaign, and 2020 was the year of the nurse and the midwife, but it was the year of the pandemic as well. And so everything we'd planned, of course, didn't happen as we thought it would happen. But we managed to keep nursing very high on the agenda, very front and center, and that's what we need to do now as we move into 2021 and we move into the future. We are in the middle, Nursing Now is still in the middle of an advocacy campaign. We don't end officially till May. And of course, we really, really want you all to remain involved with that advocacy campaign, which we're doing in alignment, of course, with ICN and WHO. We're calling it Nurses Together. And that's partly because we're thinking about the bigger health workforce as well this year, health and care workers, and we recognize that nurses are always part of a bigger team, but also because nurses together are so much more powerful than each of us is on our own. And we really have acted as a campaign very much as a convener of nurses at all levels, really. But what we've encouraged our country groups to do is to bring together professional associations, the chief nurse, education, WHO where you can, and young nurses. So important to all of us. And we've encouraged that convening of all of these people because we recognize that together we really can make a difference. We can help each other, we can inform each other, and we can show each other in our best light. And nursing hasn't always been that way. And in fact, nurses quite often get involved in fighting each other more enthusiastically than fighting anybody else. We want to move away from that as we move forward, and we want to move into a world where we are all advocating for good investments, strategic investments in nursing, including more nurses, decent working conditions and rewards, the equipment that we need, and the opportunities to be included in policy making and health system design. And we can only do that if we do it together. So we're thrilled that ICN, who has always brought nurses together, can continue to do it with our groups, the Nursing Now groups. And we know that this is the beginning of a really exciting future together. Thank you, Susan. Back to you.
Thanks, Barbara. And I don't think we should underestimate the enormous amount of work that you and your very small team have been doing over the last 3 years and will continue to do in this last phase of the campaign. We are about to hand over to listen to some of you, the groups, and the plans you have and how you would like to work together in country and with ICN. Just before that, I would like to briefly introduce a couple of people from ICN who you will become familiar with during the webinar, but also familiar with as we go forward. And the first one is Francesco, if you could introduce yourself.
Hello, everyone. I am Francesco, the Digital Communication Officer for ICN, and I will be working closely with Susan, and in the future I will be your point of contact for the Nursing Now work together with ICN. And yeah, I would like to introduce you also the head of digital, Pilar, who is also Spanish speaker, so we're really happy that she's here today.
Hello, everybody. Nice to meet you and nice to have you all here. So I take care of the digital side of ICN. So any issues with website, social media and whatnot, please feel free to come to me.
Thank you very much to Francesco and Pilar. And Pilar is also a very important person today because she will be keeping time on you and letting you know if you're staying within time for your presentations. So it's with great pleasure that I turn to our first speaker, who is Walter De Caro, who is president of the Italian Nurses Association and who's going to talk a bit about Nursing Now Italy's plans for the future and working with ICN. Over to you, Walter.
Hello, everyone. Thank you for this opportunity to share today about Nursing Now in Italy. I try to show only some slides about our past and future. In this slide is only photos. This is the photos of some initiative. We have the official launch of Nursing Now in Italy in May 2019 with Lord Nigel Crisp and with our Catton, and together with a number of politicians. During the time, we spread this Nursing Now in several university, hospital, local health agency, and we have some meeting with Ministry of Health that is in the center of these photos that participate at Nursing Now conference. And same time, the President of Italian Republic for this for Nursing Now Italy give a special medal and a special medal about our network. If it's possible, this is what we did during the time for Nursing Now. We set up a network where we tried to raise awareness about the aims of Nursing Now. Particularly important on this matter was the role of Federsanità. Federsanità is a network of Italian agency and hospital, is a large network. At the same time, we involve a lot of regulators and also the order of physician and some other entity, also not related to health. We try to carry out constant monitoring of health data, and as idea, we, in the light of above, we think that in this year, pandemic is a problem, but the voice of Nursing Now in Italian context was developed. About the close future. About the close future, our idea was to increase the number of associations in this network, And this is the real activities plan. The real activities plan is continue to our campaign to unlock nursing potential for community and family nursing, for advanced nursing competence, and for leadership in policy at local and national level. Develop a leadership course and start with gratitude campaign. In Italy, we have more than 80 nurses that die. We want that the public express gratitude for these nurses, for the nurses that work every day for the health. At the same time, this year in Italy, we have G20 meeting with a lot of country, and we hope to have a conference with nursing association of 20 country, and we hope that ICN help us to set up this conference, and ICN help us to give a strong voice for G20 in Italy this year. Also in Italy this year, there is the health summit COVID related. We have a lot of work to do. We work for improved visibility and power of nurse, for have a better health, and for improve the outcome of health for population. Thank you for your attention.
Thank you very much, Walter, for kicking us off today. And now I'm going to hand straight over to Nursing Now Mexico, to Claudia Hernandez, who is Director of Nursing at the Department of Health in Mexico, who's going to talk about Nursing Now Mexico's plans. Over to you, Claudia.
Hola, ¿me escuchan?
Can you hear me? Asks Claudia. Hello,
Yes, we can hear you.
Yes, we can hear you.
Yes, thank you. Good morning, everyone. Good afternoon in other parts of the world. Thank you to the International Council of Nurses for allowing us to present our past activities and the future of nursing now in Mexico. This campaign is being coordinated from the Ministry of Health of our country with the nursing leaders of many institutions, health, schools, associations, and colleges. This campaign was introduced officially in our countries with the authority of the ministry on November 2018, and the following year we had a major actions to begin with. A number of actions that we undertook were a massive mass dissemination of campaigns. And let me say that in Mexico, we launched a main campaign at a national level with more than 40,000 nurses, and also with strategic players, policymakers, and decision makers in terms of health. As to the strengthening of leadership activities, there is a diploma or degree for the strengthening of management skills and leadership. And what we did was to put together a partnership in order to strengthen leadership skills, and we trained many nurses, but we had more than 8,500 nurses in this program. So it's important to highlight that. And it's important in the future to continue working on this strategy in order to enhance the nursing training. We have 2 universities that are already developing this syllabus, and they're ready to start the syllabus to train advanced practice nurses for chronic disease and nurses in the front line. seeking to expand the role of nurses in order to provide a better response to health services. Another major response is that this year we advanced in the political dialogue to increase the number of nurses, because in our countries
30
we have
segundos.
350,000. We have a big population, so that's a big challenge. So we need to strengthen that. Many of these activities were already being taking place, but the pandemic caused us to get behind. So we haven't finished the whole campaign. We are just making a pause here, but we consider it's necessary to continue and to move forward. Well, this is a very general overview of what we're doing and what we plan to do in the future. From the students' point of view, my colleague Imior Casitas will be involved, and Maestra Perla is going to talk about the colleges. Thank you.
Thank you very much, Claudia. And we're very aware that there's a lot of activity going on in Mexico and across Latin America in relation to nursing now. And it's great that at least we've got a snapshot here. We're moving on now to look at one of the regional groupings. This is a regional Latin American grouping, which is called UNursing LATAM, who are very active regionally. And Javier Isidro Rodriguez Lopez, who is the general director of the campaign, is going to tell us a bit about that cross-regional work now and what they have planned for the future.
Muy buenos días.
Good morning, everyone.
Hola, ¿me escuchan?
Can you all hear me? Can you hear me all right?
Yes, yes.
Bueno, muy buenos días. Un gusto poder compartir el día
Good
de hoy.
morning. It's a pleasure for me to be here with you. Special greetings to Susan Williams, Barbara Stilwell, Howard Cotton, and all the participants today. Today, we get the opportunity to introduce to you through our foundation this good work of union that is born after the many initiatives for development of nursing now worldwide, and through the strategic guidelines and leadership and necessary nursing leadership for Latin America. Since 2019, we have added more than 400,000 nurses in Latin Americans that have undergone research and training processes throughout this whole process. In 2020, we strengthened the training process, and we have included more than 100 events for training purposes in Latin Americans by running seminars, symposia, and training activities in order to strengthen the human capital in nursing. And with this, we managed to consolidate this union process of nursing in Latin America for a more united, universal, and ubiquitous nursing practice everywhere from through any device, in any instrument. At the beginning of this year, we have added more than 14 Latin American networks for nurses with colleagues and academicians. And in this process, we have made it possible for more than 40,000 nurses to be together. We have 2,500 active members and 150 partnerships among ministries of health, secretary of health, schools, colleges, universities, and many organizations that have actively worked in this campaign in 26 countries. We have also added associations and agencies from other parts of the world, such as Europe, Australia, and with these objectives that you can see on the screen, visibility, projects that generate knowledge transfer, training cooperation, and a stronger partnership.
30 segundos.
at the institutional level in order to strengthen the human capital and the social capital from Latin America to the world, and for the practice of our profession in every part of the world. So we would like to add these actions to the ICN work and for the benefit of all of us. To conclude, I'd like to thank the team that worked in the regional in the regional coordination. This is the core team, but behind them, we'd like to thank in particular the Latin American team that was involved in the many activities. And for 2021, we'd like to add more than 300,000 nurses throughout the world. Thank you very much for your attention.
Thank you very much for that. And as we can see from the photos and from the descriptions you've given, there is an awful lot of enthusiasm on the ground and amongst students and practicing nurses for rallying around this Nursing Now campaign. We're now going to go to a different part of the world, to Israel, where we're going to hear about Nursing Now Israel's plans for the future and working with the nurses associations and ICN. So I'm really pleased to hand over to Shirley Luth, who is a director in the nursing division within the Ministry of Health.
Hello everyone, I'm Shirley Luth from the Nursing Management at the Ministry of Health. Joining me on this webinar is Dr. Shoshi Goldberg, the Chief Nursing Officer. Firstly, I would like to thank you for this opportunity and to applaud the Nursing Now campaign for creating a network of nurses and for encouraging nursing to lead, to speak up and to tell their stories. In Israel, the Nursing Now campaign is led by the Ministry of Health and is a national-wide campaign. Our target as a ministry is to raise the status and the profile of nurses. During the year 2021, our objective is to continue to increase the number of nursing students in order to tackle the nursing staff shortage. We are investing in our nursing workforce and escalating professional nursing development in post-basic courses. In 2020, we recruited and doubled the number of nurses in intensive care post-basic education in order to meet the shortage of ICU nursing staff caring for COVID-19 patients. Another area of professional development is our goal to increase the number of nurse practitioners. Our theme for the International Nursing Day is I Am a Hero. Throughout the day, we will honor outstanding nurses for their leadership and work efforts during the COVID-19 outbreak. We will choose nurses that were influential in preventing the spread of the disease and for ensuring the quality and safety of care. Our nursing heroes were those who escorted and supported patients and their families throughout their illnesses. Regarding the Nightingale Challenge, originally we had purposed for 2020 Nightingale Challenge several training programs in various settings. Unfortunately, the COVID-19 outbreak led the program leaders to withdraw their plans. The good news is that the training program have resumed, 5 in number. In fact, 1 program has finished already. We would like to ask from the ISN to share with us the annual work strategic with focus on the mission and plans for 2021 in advance. Furthermore, we have received a recognition at the WHCC Center for Leadership and Government in Nursing. We are interested in sharing our webinars throughout the nursing world and would appreciate the ISN assistance in inviting all Nursing Now groups to join our webinars. So thank you all again for this opportunity.
Thank you very much, Shirley. And it was good that you referenced Nurses Day and also International Nurses Day, and how you're already making plans for that. And ICN may want to say something towards the end of the webinar as well about the work that they're doing on that. Also important to obviously to flag that one of the big benefits of nursing now has been an opportunity for nursing groups from across the world to share with each other what they're doing and offer opportunities to contribute to that work. I'm now going to hand over to Francesco, who's going to chair the second part of this seminar, where a number of participants who've registered to join the webinar have asked to say a few words as well, so we will get a broader spectrum. So I'll hand over to you, Francesco.
Thank you very much, Susan. Thank you to all the speakers, and thank you to Barbara and Howard. For this second part of the webinar, we're going to have some more interventions from some of the groups that requested to participate. Especially focusing on, as we said, the plans for Nursing Now for 2021 and how ICN can work together with Nursing Now groups. And if we're going to have a little bit of time at the end, we might take a few questions for the panel. If that's not going to be possible, we will be taking note of the questions that are included in the Q&A section of the webinar, and we will definitely work with them. So without any further ado, I'm gonna pass the word to Yesenia Musayon, who is the director of the Professional School of Nursing and coordinator of research group Cuidart and the Instituto de Medicina Tropical Alexander von Humboldt. Yesenia, I'll give you the floor.
Hello, everybody. Good morning. It's a pleasure to me share with you this space to change our plans to continue improve nursing on the world and to have opportunity to collaborate together. I am going to talk in Spanish because it's my mother tongue. Okay. Bueno, el grupo de investigación Cuidarte de la Facultad de Enfermería en Perú.
Research Group Cuidarte has one objective: developing, validating, and implementing healthcare for the health of people. We have doctors. We have also masters in other professions. We have an interdisciplinary group, which is very interesting, which also includes some students. This is our collaboration with Nursing Now, because nursing is also health and science. We are trying to develop technologies, soft and hard technologies, to give the basis for healthcare in the community, taking into account the context in which it is developed, but also these developments which are validated can be sustainable in time, also over the years. So what do we want in Cuidarte? We want to develop projects with national or international financial support, also in collaboration with other organizations. We try to prevent drug consumption, HIVs, healthcare in the family, training in nursing, also technology nursing, which is very important right now, mental health, and health management. We also have started some research on COVID, on how to care for COVID patients. We want to exchange this knowledge with nurses in other spaces, and we also work in human resources and science. So we promote fellowships in several areas. Right now, we are developing a digital platform. We are using social media to promote communication in healthcare. 30 seconds. So that our population can benefit from healthcare systems with the technology that we have available. So we promote nursing now because nursing is science, and we also give healthcare on the basis of the science progress. Thank you.
Thank you very much, Yesenia, and thanks for sharing the plans of the QuidArt group, which are very diversified and very interesting to hear. And we share, of course, the long-term vision for the future of Nursing Now groups. Now I'm gonna pass the floor to Blerina Duca, who is the president of the Albanian Order of Nurses, which is, if I am not mistaken, the Albanian Nursing Now group. To you, Blerina.
Thank you. We represent the common interest of the profession of the nurse, midwife, physiotherapist, laboratory technician, speech therapist. It's the second year for us to be part of Nursing Now. It was very difficult to work from the pandemic of COVID-19. The COVID-19 pandemic noted the importance of the nursing profession in the society to healthcare of the community where they work and live. The COVID-19 showed the importance of the efficient role of the nurses, both in hospital setting and those of primary healthcare as a bridge between the system and community. We nurses can help improve the quality of healthcare delivery, the strengthened health system. Albanian Order of Nurse seek the technical assistance to promote cross-professional cooperation in the role of nursing in responding to emergencies caused by pandemics, natural disaster, and man-made disaster. The role of nurses improving the health of patients, their family, ensuring the most efficient care and its continuity. This can be seen in areas such as home for care elderly, prevention and control non-communicable diseases, care digital training for remote mountainous areas, training of nurses to promote their role in healthcare center for service of lack and health professional, the role of nurse in the community. Changing the program of professional practice training professional to be a mentor where nurses should achieve high levels of education and training and develop the skills necessary for the preparation of nurses to work outside the acute care facility by involving nursing in the most advanced practice, to build the culture of health and health equality. Strengthening for the role of health workers to work in professional teams by evaluating the role of nursing leadership. Thank you very much.
Thank you very much, Blerina, and thank you for highlighting the importance of training, which is absolutely core. Now we're gonna change continent and we're gonna go to Nai Ying Ko, who is the president of Asian and Pacific Alliance for Nursing Education. The floor is yours, Nai.
Hi, everyone. It's nice to see you. Please call me Monica. I'm from Taiwan. And right now I'm a current president of Asian and the Pacific Alliance in Nursing Education. And first of all, I would like to introduce Taiwan Nursing Now. And Taiwan Nursing Now, we have three main themes. The first one is work with government, and then to share Nursing Now campaign, and also make people move. So the three components, we host a lot of activity in 2020. Even we hit the COVID-19, but so far in Taiwan, yeah, we zero nurses died from COVID-19. We total have 8 nurses infected with the virus in Taiwan. And the second, I would like to share, this is to educate nursing leaders, especially for the younger generation. So we host many activities for Nightingale Challenge. Even in outbreak of COVID-19, we still have different activity. We just transform to online, like webinar. Yeah, so that will be many very creativity activities online. We're using social media and using like YouTuber and Twitter to share their activities. And the last thing is, as the president of ICN, yeah, our commitment is to foster the international platform for nursing education. So we also want to share Nursing Now with other country or nursing educational institution across Asia and the Pacific region. So in our platform, we share their Nursing Now activity and the campaign or other in conference talking about Nursing Now, we share on our platform. And also we host several webinars to share their
30 seconds.
experience. Yeah, that's it. Thank you.
Thank you very much, Monica. Thank you for sharing the plans of Taiwanese Nursing Now groups. Now we're gonna leave the floor to José Luis Cobos Serrano from the Consejo General de Enfermería de España and Nursing Now Spain. To you, José Luis.
Thank you very much, Francesco, and thank you very much, Howard and everyone. Les hablaré en español. Muchas gracias.
I'm going to speak Spanish. Thank you for this opportunity of getting together. I think that we should keep doing these kinds of initiatives, implementing these initiatives. I think this is very important, getting to know all the nursing community everywhere in the world and all health professionals. Thank you to all the Nursing Now groups. In Spain, we have a lot of impact. We have local groups in our regions, and we also have a Nursing Now group in Spain, a national one. Thank you to National Steward. She was with us in a meeting in the Nursing Now Spain group. I'm going to try to tell you what we are going to do in the following year. We've sent a dossier with all the actions implemented in Spain and the repercussion. I think that the pandemic has had a lot of impact, and we have to see it as an opportunity, not only as a hurdle. It has stopped or slowed down many of our activities, but it has also been an opportunity to make more visible our profession and all the actions and the activities that we implement to improve the health system. We have 3 focuses: nursing, hiring of nursing staffing, and representation, also leadership in the health sector. With regards to staffing, we have several initiatives. We've talked about it before. We are proposing an act with a minimum ratio of nurses. I think this is very important to also implement in other countries. Sometimes legal aspects are more difficult, but not all countries have established all the quotas and the ratios. For years, we've had many problems with WHO because they didn't count on enough professionals. And ICN has to define very well which is the profile that we are searching for graduates in nursing programs. Concerning participation in decision making, we are contacting regional governments to improve participation in decision making bodies. We've talked to the ministry, we've talked with our regional governments so that we can check what are our strategies towards the future, because we want to improve the ratios of nurses in the health sector. And with regards to leadership, we've implemented a leadership program. We've shared it with Latin American countries because we all speak Spanish, and ICN can coordinate these kinds of initiatives because we can share information. It's a way of channeling information. We also do it in our European Federation. We've been working in advanced nursing practices by means of a survey. And I think this is something that we can work on together, defining, as I was saying, different profiles. In Europe, we have many problems with this. Yes, we have a degree, but not in advanced nursing practice. So I acknowledge the work of all the people who have worked in nursing now. In Spain, we've had a big impact, and I'm sure that we will continue to do some progress. And lastly, I would like to say that we need unity in all different areas of the profession. We've made possible that science organizations, academia, students have only one voice, and we all talked to the government with one voice. So that's the line that that's the path we want to take. Thank you.
Thank you very much, Jose Luis. I would like to thank you for sharing the view of Nursing Now Spain, and share also the hope that in the future ICN and the Nursing Now groups, in particular also the Spanish speaking groups, can work together to better coordinate the actions that we will take. Now I'm gonna pass the floor to Leticia Bernuez Caudillo, who is a registered nurse, part of belonging to the Nursing Now Madrid group. To you, Leticia.
Hello, everyone. Thank you very much for the opportunity to be here today. As you say, my name is Leticia. I'm a nurse in Madrid, Spain, and a member of the local group Nursing Now Madrid. We are a small group of Nursing Now founded in 2019 by the Madrid Nursing Association in collaboration with several nurses from different fields. From the beginning, we've been very active, working in a lot of activities. We even managed to speak about the campaign with the Ministry of Health in Spain and to the several politicians here in Madrid. But unfortunately, in 2020, we had to stop almost all our plans because we had to focus on the coronavirus crisis. However, we didn't want to miss the opportunity to show how the crisis was affecting nurses and how nurses feel about being a nurse in Spain and what they want for the future. That's why we decided to do a survey based on a survey done by the Royal College of Nursing in UK last year. We surveyed more than 2,000 nurses, and we did a report linking our data with the objective of the Nursing Now campaign. From this report, we create our lines of work for the future. So now we want to keep working to make proposals about how to improve the status of nurses to our politicians. In order to do that, we will need to obtain more data about the state of nurses in Spain, and we would like also to have the opinion of the experts on different aspects of nursing. We will appreciate the help of the ICN on those points, maybe helping us to obtain the data, doing more surveys, or organizing webinars as you've been doing so far. Also, we would like you to help us to keep contact with the different Nursing Now groups around the world, because it's been amazing during the campaign to be able to listen and learn from nurses in different countries. And it will be great if we can work together and help each other, because we have in common a lot of problems that affect nurses. And we think that working together, we can be stronger. So thank you very much for all the work that you've been doing. And we are here for anything that you will need and anything we could help. Thank you very much.
Thank you very much, Leticia, and thank you for sharing the unique perspective of nurses in Madrid, and also for your request for support by ICN in providing data. This is something that we have been trying to improve on and to work on. And we hope that we can really support and help the Nursing Now groups also on this side. And now we're going to Mexico to Amy Horcasitas, who is the president of the Asociación Mexicana de Estudiantes en Enfermería. To you, Amy.
Muchas gracias. Buenos días, buenas tardes y buenas noches a todos.
Thank you. Good morning, good afternoon, good evening. Among the actions that we've taken from the Student Association, we have launched the campaign in more than 28 federative entities, including different schools and colleges, nursing colleges, in addition to clinics and hospitals. And sometimes we have also included advisors together with representatives of local entities. Right now, we are the voice of the Mexican nursing profession, and we are focusing, we're trying to promote visibility and professionalism of our profession. We are also running another campaign, Nursing Now in Latin America, that was launched in July 2019 in Yucatan, where we got together with the student associations from Latin America, and together we made it possible to launch the campaign. At the same time, we have work together with the permanent commission to launch the advanced nursing practice training for all students and trainees. In this case, we had about more than 25,000 people that benefited from this program, including nursing professionals, students, and trainees. We did the training courses both virtually and in presence to promote advanced evidence-based practice and seeking to increase the quality of our profession. We also worked in different partnerships nationally and internationally to increase representativity, the visibility, and fostering leadership. Another major thing that I would like to highlight is that we have also spoke up locally and internationally to demand that integrity of all the nurses is ensured. For the future, we're working on proposals.
30 segundos.
And we are pending the acceptance to participate with other student associations in the Americas. We are implementing a mentoring program to strengthen youth leadership. We are also working together with with other international student associations. We're trying to raise the voice of the youth nurses, working together with different associations. And for the first time, a number of young students is going to participate at the ICN Congress that is going to take place this year. Thank you.
Thank you very much, Amy, and thank you for highlighting the very important contribution of students to the movement and to sharing the very interesting initiatives that you have taken. I would like to now, first of all, thank you for your patience. We're a little over time. We have one last speaker. So without any further ado, I'm going to pass the floor to Ms. Perla Idolina Barragan Sosa, who is the Presidente del Colegio Nacional de Enfermeras de México.
Muy buenos días a todos. Tengo un problema con mi cámara. No me veo.
Good morning, everyone. I have a problem with my camera. That's why you cannot see me. Thank you, though, for the invitation. In our country, well, as Dr. Leija mentioned it, we have the National Nursing College that has a major impact of frontline practitioners. First of all, by implementing nursing programs, because we are trying to change lifestyles to make them more healthy and promoting health. And also we are we adhere to the objectives of for development, and we are also working on helping pregnant women. And unfortunately, because of the pandemic, the schools have been closed, but the nurses that are leading this project are being supported by a multidisciplinary project. We also, this is related to another program. We have made an agreement with Spain, and we can give you more information if you so desire. Right now, the legal consultant is doing a running campaign in order to carry out this project. We are also working strongly with the students. For us, the students are very important. It's a very important group. Also, in the Singapore meeting where the calling was launched for to take more actions. We have also planned to make agreements with the Polytechnical College of our countries and with other international schools that are pending of signature in order to develop our profession. Thank you for your attention.
Creo que acabé antes, afortunadamente.
Thank you very much, Paola, for your contribution, and to all of you for contributing today. A couple of very brief roundup remarks. First, to thank all of you for the work that you've done, and to the ICN staff for making this happen. We've recorded the session, and we're also aware that people have been posting comments and questions. Obviously, we'll capture all of those so that we've picked up everything that you want to say to us and that you want to know more about. And just before we finish up, a couple of closing remarks from Howard Cattons, particularly around what's coming up this year also for ICN. So over to you, Howard.
Susan, thank you. And thank you, colleagues, for incredibly rich, informative and exciting presentations and plans and initiatives that you're working on. And there were clearly some very, very strong themes that were shared across you. Just very briefly, I wanted to pick up, Shirley, I think it was you asked, and a couple of others, just in terms of what some of our milestones are for this year. We can share more on this, but I just wanted to come back immediately on that. The period we're in now in the run up to May feels is incredibly important. Next month, we will have the official 1-year anniversary of the pandemic being declared, which is an opportunity to reflect on the nursing response to the pandemic 1 year in. The following month in April is World Health Day. And again, I think vaccines, equity of access to vaccines and the rollout globally of the vaccine program will be a huge focus. And that will be tied into some announcements around the year of the healthcare worker as well. That then takes us into May, the World Health Assembly. I've said already that we're working on the next global nursing strategy, nursing and midwifery strategy to be approved, we hope, at the World Health Assembly in May. The 12th of May, obviously International Nurses Day, will be the publication of our report, our association's get that in advance of International Nurses Day. And this year, I absolutely anticipate that we will make that available to you Nursing Now groups as well. The focus of International Nurses Day, the ICN publication, is on future healthcare systems. So it's trying to do that piece of just obviously to look at what we've been through, but to think forward to the future. And on International Day of the Midwives in May, the State of the World's Midwifery, the second or third time that they've had that report, will be launched as well. So the next 3 months is incredibly busy. Once we get that out of the way, our thoughts then need to turn to how we ensure implementation of our global nursing strategy, what the measures, the metrics are, how we do that work, how we make sure that that strategy is taken by countries and lives and is implemented, which will run us through to our Congress 2nd to 4th of November. And I think, without giving anything away, very, very many of the big issues you have talked about in this webinar, and which were talked about in the other webinar as well, you know, whether it be working conditions, whether it be advanced practice, whether it be leadership, whether it be younger nurses and the future of the profession, these are all going to feature on the program for the Congress as well. Final point, and I said it before, but just to say again that our board will be considering everything that you've said, as well as looking to the future when they meet in May. I think that you will be hearing from us and from Susan before May, because there's some information that we'll want to follow up on with you. And then once Barbara and the Nursing Now team have officially closed out, because we're still in a transition, and obviously, as Barbara said, Nursing Now continues to run until May, and they will lead until May. But we will want to come back with you again after May to have, you know, some more detailed conversations about what comes next. So it's a bit of a nutshell, but just gives you I hope gives you a flavour. Listen, just again, my personal thanks for your time, your commitment, and the great presentations. It leaves me very, very excited about the future. Together, as Barbara said, and together has been the watchword of ICN President Annette Kennedy through her presidential term. Every ICN president has a watchword, and Annette's for her term has been together. Susan, back to you.
Thank you. And just finally, just to make sure that all of you know how to contact ICN, particularly for the Nursing Now groups, Francesco will just share with you the contact details, so that if you need to contact us or you have queries about anything, you know how to get in touch. Thank you to all of you, and obviously we will be in touch.
Thank you all.